Welcome to In the Know Medical Imaging, where we make medical imaging easy to understand. Standard CT scans are fantastic at showing us where a kidney stone or joint crystal is located, but what if a scan could tell us exactly what it is made of without invasive testing? That is the power of dual energy CT. Today, we are exploring spectral CT. We will explain what patients experience during material characterization scans while breaking down K-edge absorption, material decomposition algorithms, and dual-source physics for our technologist community. For patients, knowing the exact chemical composition of a stone or joint deposit completely changes your treatment plan. In the past, a standard X-ray or CT scan showed all kidney stones as bright white spots, leaving doctors to guess their makeup. With dual energy CT, your care team can instantly distinguish uric acid stones from dense calcium stones. This prevents unnecessary surgeries, allowing doctors to dissolve certain stones using targeted medications instead. From a patient standpoint, undergoing a dual energy CT scan feels no different than a standard CT scan. You lie comfortably on the table, slide smoothly through the scanner bore, and the scan finishes in just a few seconds. No special recovery time is needed, and advanced scanner technology ensures that acquiring two energy levels simultaneously keeps your overall radiation dose comparable to traditional single energy scans. For our technologist and student community, dual energy CT relies on fundamental X-ray interaction physics. Single energy CT measures linear attenuation coefficients at a single energy spectrum, where different materials can share identical Hounsfield units. By scanning anatomy simultaneously at two distinct energy levels, we exploit differences in mass attenuation coefficients caused by the photoelectric effect. Materials with higher atomic numbers show a much sharper drop in attenuation at higher energies, allowing us to separate tissue types based on chemical composition. Vendors achieve dual energy separation through distinct hardware architectures. Dual-source CT uses two X-ray tubes and two detectors mounted at 90 degrees. Rapid key veep switching rapidly toggles a single X-ray tube between high and low energy spectra in microseconds. Dual-layer detectors use a single X-ray tube with a sandwich detector where the top layer absorbs low-energy photons and the bottom layer captures high-energy photons. Split filter system. Use tin filters to split a single beam into distinct high and low energy spectra. Once data is acquired, mathematical basis pair algorithms process the high and low energy datasets through material decomposition by assuming any tissue can be represented as a combination of two basis materials, such as water and iodine or uric acid and calcium. The system calculates exact concentration values per voxel. This generates virtual monoenergetic images, allows iodine quantification, and produces color-coded material overlay maps for precise diagnostic evaluation. One of the greatest clinical efficiency advantages of DECT is the ability to create virtual non-contrast datasets. In routine multiphase abdominal protocols, patients traditionally receive a true unenhanced scan followed by contrast-enhanced phases. With spectral CT, technologists can digitally subtract iodine from a single contrast-enhanced acquisition to generate a virtual non-contrast image. This eliminates a full scan phase, significantly lowering cumulative patient radiation dose under ALRA principles. In rheumatology, DECT serves as the non-invasive gold standard for diagnosing gout. By applying specific material decomposition thresholds, the processing workstation identifies monosodium urate crystal deposits and highlights them in vivid green, distinguishing them from surrounding calcium bone density. Technologists can quantify exact tophus volumes, providing clinicians with a baseline to track crystal dissolution during urate-lowering therapy. The diagnostic clarity of dual energy CT directly guides precision medicine. Identifying a renal calculus as uric acid allows urologists to initiate oral alkalinization therapy, dissolving the stone naturally without invasive surgical intervention. In vascular and oncologic imaging, spectral mapping enhances low-contrast lesion detection and removes dense calcifications, delivering higher diagnostic confidence. Dual energy CT bridges basic physics and clinical care, transforming how we identify disease and tailor patient treatment. Thanks for watching. If you learned something today, make sure to like, comment, and subscribe, and check out our merch store for more cool medical imaging items.